Why is it important to know the cause of my child's epilepsy?
Well, this is such an important question, and I do encourage families and caregivers to talk to their doctors about exactly what's going on. The doctor may not know at that time, and you might need to ask, well, what other tests could be done if they're could be done, but they're not recommended at that time to ask. Why not? So it is so important to get an answer for why a patient is having seizures in order to direct treatment and so that child can have the best outcome possible. There are many different treatments which may not be considered if we don't know the exact cause. And I think this question comes up in a lot of people's minds lately or in the last several years with regards to genetics, because that field is rapidly expanding, and not every practice in the country or the world is utilizing genetic testing, and so that's where this probably comes up most, but it can be even more basic than that. So a child presents with something that might be a seizure, and a neurologist will evaluate those symptoms and decide, could it be a seizure? If so, what kind? Is it a generalized seizure coming from both sides of the brain? Is it a focal seizure, meaning coming from one area of the brain? And looking at the age of the patient and other features of their presentation, like their development so far and their examination, they might decide that this patient fits into a specific epilepsy syndrome or a collection of symptoms that we know occurs in children. Some of them we may think they're going to outgrow it in several years and know exactly what medication to choose, and may tailor which tests that we do after that. After the EEG and the questions and examination, we may have our answer. We may not need to do an MRI or other testing at that point. But there are other children where we're not sure exactly what the cause is, and especially if it's a focal epilepsy, we might want to do an MRI. And if the MRI of the brain doesn't show anything, there's other tests that use different techniques to find abnormalities in the brain, something called a PET scan, SPECT scan, MEG scan, and longer EEGs that go overnight or are done in the hospital off medication to record where the seizures are coming from. And all of these things might lead to, say, the seizures are all coming from this one specific area. And then a team of doctors, including a neurosurgeon, might give other options that include surgery or other newer techniques with something called neuromodulation, like VNS, DBS, or RNS. So that's if the seizures aren't controlled. And with genetics, it could be a focal seizure, but maybe more commonly generalized seizures. This can be usually diagnosed now with a gene panel. These are actually available free in the United States for children under the age of 8 years old. Insurance shouldn't be a hindrance there. And this will test for several hundred genes that are known to be associated with epilepsies of all causes, and your doctor will be able to sort through those results and see if one of the answers that came back fits your child's presentation. There are a handful of genetic causes that have specific treatments, either do give these medicines, don't give these medicines, that might give a better outcome than if we're just guessing or choosing the medicines based on the seizures and the presentation alone. So getting to that answer of why can really help with the treatment. And lastly, if it is a genetic or even if it's a brain structural cause, knowing that underlying cause can be very reassuring for families. Living with the uncertainty of the cause of their child's epilepsy can be very distressing, and at least knowing the cause can be reassuring in a difficult situation. And families have been known to band together into parent founded foundations to discuss their children together and see similarities between them and get support and also help to benefit their children as best that they can. So with all those different modalities, it's good to talk to your doctor and have them explain what tests there are available. And doctor may explain, I don't recommend doing this test right now because of reason X, Y, Z. And that might be the case, but there should be a good explanation and understanding of why.